Welcome, welcome, Janet. Thank you for joining me here on the Valder Beebe Show live out of Dallas, Texas. I am so honored that you guys are going to be talking with me. And Dr. Porter, I'm going to start with you about lung cancer. First of all, can you tell me what lung cancer is?
Right. So lung cancer means that the cancer actually originated in the lungs. And the most common type of lung cancer is non-small cell lung cancer.
What does it mean to have this ROS1 diagnosis of non-small cell lung cancer then?
Right. So when we diagnose a patient with non-small cell lung cancer, we do biomarker testing to look for gene abnormalities. And ROS1 is one of those gene abnormalities. And for patients who have ROS1 positive non-small cell lung cancer, we identified that abnormality on their biomarker testing.
So that's the first step of identifying the problem. It sounds like has the disease been present when you guys find it? Does it have to be advanced for you to find it?
Well, unfortunately, with non-small cell lung cancer, often patients are asymptomatic until the disease is advanced. We have new screening and ways to identify the disease early, but most often it's diagnosed a little bit later or more advanced because there's not a lot of symptoms at the beginning.
Are there any new treatment options? Because technology in medicine is taking us at quantum leaps.
It is. And so recently, the FDA has approved a therapy called Augtyro or repotrectinib, and that's developed by Bristol Myers Squibb, with whom we're here today. And their approval is for adults who have non-small cell lung cancer that's spread within the chest or to other parts of the body, and it's caused by this abnormal ROS1 gene. And when patients use this therapy, they can have some side effects like dizziness, but of course we know each patient is unique. And so if you're having side effects, you have to discuss it with your doctor. But you can learn more about the therapy at augtyro.com. Let me spell it for you. It's AUGTYRO.com.
Okay, I'm going to move to Janet just for a moment. Janet, if you could tell me how significant is the latest approval for patients and their doctors?
Oh, this is very significant. I am not just an advocate for ROS1 lung cancer. I am also a patient. I was diagnosed in 2011, and back then, about half of patients died within the first year. However, with biomarker testing and targeted therapies, this is changing. But cancer is smart. It finds a way to get around the treatment, and getting new treatments available to us means that we have more time with our families.
You've been on this journey with this disease. What would you say to someone who is not as confident with this disease going on, but they're listening to the sound of your voice?
I think it's very important when you're diagnosed with any lung cancer to be a self-advocate, to learn more about your disease and ask questions. And one thing it's very important to ask, especially if you're diagnosed with non-small cell lung cancer, is ask your doctor about biomarker testing. But you can also learn more about ROS1 cancer in particular at a website, theroswonders.org. I'll spell that for you, THEROS, the number 1, DERS.org. And we also have a Facebook group where you can talk to other patients who have this disease.
Thank you so much for sharing your story. I'm so glad that you're here to share that with my audience. Dr. Porter, is Janet's journey with small cell lung cancer, is it typical? Is it unique? What is it?
So I think every patient is unique. The patients who have gene alterations or fusions like ROS1, the type of the disease that Janet has been diagnosed with, are very unique. We mentioned earlier, they're usually younger patients. They usually don't have a history of smoking, and usually female. So the things that we typically think about, radon exposure, smoking, occupational exposures, and then also secondhand smoke exposure, we don't usually see those things in these patients with ROS1 positive non-small cell lung cancer. But it's such a blessing to have new therapies, and for me to be able to offer these therapies to my patients, it gives me a lot of hope.
I want my audience to know I'm speaking with Dr. Jason Porter. He's a medical oncologist and a hematologist, and he comes well qualified to talk on this subject. I want to thank you and both Janet for coming to the Valder Beebe Show to talk about this. My audience, is made of people born between 1946 and 1964. We call them baby boomers, and a lot of them have expressed concern about this particular disease. So thank you so much for talking about it. I really appreciate it.
Well, thank you for having us.
Thank you both for being my guest on the Valder Beebe Show. It's been my pleasure.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.